Welcome to Cancer Specialist Medical Minute.
With Dr. Rick and Dr. Danny.
That's Dr. Rick.
And that's Dr. Danny, and we're excited to be back for another episode. And I'm already dreading that look on your face, Dr. Danny. Tells me you got a joke.
We've got another dad joke. I don't know why you're resisting this so much, Dr. Rick. I think the last one, how many hits did we have after that last joke?
A million.
About a million?
We're on the top of the charts.
Yeah,
just from the joke.
I think you're like looking at the chart upside down. It's actually plunging way down, our ratings when you tell jokes. But go ahead. No, I really want to hear this one.
All right.
My parents love the joke, and they are our only reviewers.
Shout out to your parents, actually. The OGs, as we call them.
The OG listeners.
Yes.
All right. Did you know that the first French fries weren't actually cooked in France?
I didn't know that.
They were cooked in Greece.
Oh, yikes. Well, June is Cancer Survivors Month, and as oncologists, survivorship is, of course, the ultimate goal. We could talk to a bunch of patients and go through our experiences with those patients about survivorship, but I think we got something a little bit better planned. Isn't that right?
Oh, that's right, Dr. Rick. We have someone special here today, Dr. Siegel, and after practicing oncology for over 30 years, he chose to be treated by those physicians who he trusts the most, his colleagues here at Cancer Specialists, and he's here to tell you a little bit about himself.
So I'll just give a quick one-liner. Dr. Siegel joined Cancer Specialists of North Florida back in 1988. He's board certified in medical oncology and internal medicine, and he was kind enough to drive out here from our Clay office to, we'll call it the Medical Minute home base. We'll work on titles with that.
The pod loft.
The pod loft, I like that. Yes. But Dr. Siegel, thank you so much for being here, and please feel free to add on to that introduction and tell us your story.
Well, thank you very much. It's a pleasure to be here. It's a pleasure to tell my story. I was diagnosed 8 years ago with a stage 4 lymphoma. I actually diagnosed myself. I had some more pain. It was running out of proportion to what I thought, and got some scans and saw areas of my bones, multiple lytic lesions in my bones. A lytic lesion means that the bone is actually being eaten away. And it took two biopsies, but finally they got a diagnosis of follicular lymphoma stage 4. Now, being a medical oncologist, follicular lymphoma means to me that it is not one of the very aggressive lymphomas. And so to some extent I was happy that I had a diagnosis and knew that I had therapy that would be effective. I chose one of my partners to be my physician. I trust him. I trusted his expertise. I trusted his humanity is the word I'm looking for. And I was very, very pleased with doing so.
Who is your physician, if you don't mind me asking?
Dr. Baddernath. I like the fact that I was treated locally. I didn't have to go anywhere. I didn't have to get in my car and make a special treatments. And to tell you the truth, I would see patients in the morning, get my treatments in the afternoon, and start the same thing over the next day. So I think when people get that diagnosis of cancer, it can be really a life changer for certain people. And you have to realize that with our therapies that we have now, we're breaking the glass ceiling. We have such better therapies that are so much more effective and less toxic. And, when I was growing up, nobody talked about cancer. It was something that was hidden. It was put on the back shelf. You whispered about it. The kids never knew that, that somebody had cancer. And now, we talk about it. We're a lot more open. And we have better therapies.
Well, thank you for sharing that. I think it's something that as an oncologist, putting yourself in the shoes of trying to be both the patient, but also I'm sure it was tempting to, of course, want to be the clinician as well. Was that a struggle for you at times to try to balance that, or did you kind of let it go and let your partner kind of take over?
I let my partner take over, but yes, it was a little bit of a balance. I think it was hardest on my wife. We had to, when I was diagnosed, I had to make that call to my children and to my brothers and sisters. My parents are no longer alive, so and so I called my loved ones and let them know, and they were very supportive. But I think it hit my wife harder than it hit me because it was unknown to her. I'm in the clinic. I'm seeing patients every day. I see what they go through, and I know what these regimens are like, and I know what different diagnoses are. But to her, it was an unknown. And I think that's, a lot of the fear is, what's the unknown? What's going to happen? What's going to happen with my life? What's going to happen with my kids? What's going to happen with my job? Am I going to have pain? Am I going to be sick? All those things are unknown. And so I actually think that I had a leg up on a lot of people since I was so involved in the field.
I think as clinicians, we understand what the side effects of therapies are because we read about it. We anecdotally have experiences with all of our patients who undergo the treatments. But as a patient yourself who underwent a treatment that you probably administered to other patients, what was the difference that stood out to you, and what were there some surprises along the way? Can you tell us a little bit about your treatment experience?
So I was a little surprised. I had a little more nausea than I thought I would. It never got to the point where I was sick and throwing up, but I just had this chronic nausea that I just couldn't shake. I would get my treatments on Thursday and Friday, and without fail, within 5 minutes of the treatments leaving my body, I would have hiccups that would last the entire weekend. That drove my wife crazy. Because we tried to do things as normally as possible, and we go out to a movie, and I'm having hiccups on hiccups, and miraculously on Monday they would disappear. So, but that was one of the things. The pain from the new Elasta shot was a kick in the kick in the butt. Those are some of the biggest things I was surprised about.
Has it reframed at all how, when you've seen patients since, when you explain not just the specific therapies that you had, but just generally speaking when you're talking to patients these days?
So it does. I have a little more patience. And when I tell patients that I'm a cancer survivor, I think they listen, and I think they believe in what I say a little bit more.
It's the ultimate credibility.
Yes.
Now, we all have patients who, look into alternative treatment options and, think about adjuvant treatments or treatments that are can be helpful in taking care of ancillary, treating side effects of treatments. Were there any treatments that you explored outside of the prescribed course of your therapy?
No, not really. I tried a couple of different anti-nausea medicines, one of which made me worse off than the treatments itself. So, but no, and one of the reasons why is that you don't know what are in some of these treatments. You don't know if they are going to potentiate side effects, whether they are going to interfere with the mechanism of which way in which the drugs work. You don't know if they're going to exacerbate some of the side effects that you have, and all those are unproven treatments. And so no, I didn't really venture outside the normal room.
I think you touched on it earlier, but sometimes at least what I see in the clinic is the toughest is the family members, caregivers of patients, and sort of what their role is, how they can help. And you talked about telling your wife, of course, about the diagnosis. Is there anything from your expertise and experience that, advice you can give to caregivers when they come in with their family member who may have a new diagnosis, things they can do to help, questions to ask, that sort of thing?
So I think they have to be, they have to realize, number one, to listen to the patient and to listen to the physician. We're all in this together. It's not like we are above anybody else. I think if we join in the fight together, I think we're much, much more effective.
Did you have any interest in exploring, for example, a clinical trial? Some patients, choose to go to a tertiary center and explore clinical trials. I think, for different types of lymphomas, there are good trials out there. Was that something you looked into before you started treatment?
So I did. Before I started therapy, I went to the University of Florida. I actually know the head of the research department. He was one of the attendings when I was a fellow there. And so I went there and we discussed my case and different clinical trials. But they didn't have anything more to offer that I can get at home.
And I think that's, having a conversation with your provider and candidly talking about if you are exploring a clinical trial to say, is this something that is worthwhile pursuing? And, are they exploring a new therapy on top of the standard of care therapy? Is this, phase 1 or phase 2 trial, which, may not, again, be the right answer for certain types of cancer? So I think having a conversation with your provider about that's crucial.
Yeah, I think framing the discussion is very important when you speak to patients. So, at least the way I try to do it in some situations is you say, here's the different options, here's the pluses and minuses of both, here's potential clinical trials that are open. Because I think what's most important is once a patient commits to a treatment, is they feel fully on board to not only the treatment, but the team that's administering the treatment, their family, and everyone else who's involved in the decision-making process feels on board. I think it allows for just such a smoother start and finish through care, because everyone feels comfortable that they've heard all their options. They feel comfortable with what's being presented to them. No one feels strong-armed into doing something they may or may not want to do. Because I think what I would, the horror I would always have is if something happened, would the patient look back and say, well, I didn't know about X, Y, and Z was available. And I think that's important. So, no, I think research is obviously clinical trials are a huge part of that.
And I think, there has been over the years been some breakthroughs in follicular lymphoma, the type of lymphoma you've been treated for. And I think CSNF has, since we've been here, Rick, has really opened up a number of trials, not only for lymphomas but other cancers. So I think just giving patients the option of those trials, I think is amazing that we have that capability here.
And I think those options are great. And I think that the patients and the patients' families need to know about those options. But they are still looking to you for guidance.
Absolutely.
And you are still captain of the ship.
Absolutely.
And having a good, frank discussion with them involving patients and family is always very important. But in the end, they're going to say, well, doctor, what do you recommend? And so you still have to be the captain of the ship.
No, it's a team sport, but clearly we have the training and should at least lend our opinion and sort of why. And you also need to lay out why this is your opinion. It's not a dogmatic, from the top, you have to do this. It's, I think you should do this, and here are the reasons why, is sort of, I think, how, and Dr. Siegel, you could probably speak to this much better than I can, maybe how medicine has changed over the years of going from a top-down approach to maybe more of a team-based approach.
It has changed in many, many ways. It really has. From oncology, what we have to offer for our patients.
And obviously you've been with this group in its form one way or another for a long time. Can you just touch on, obviously Jacksonville has changed quite a bit since you've been here, but just touch on how the practice has evolved. You mentioned therapies, but just in general, I would just, as this is kind of me nerding out, can just tell me how things have changed and, what's been different for you throughout the years.
So when I started with one other physician, and there were lots of mom and pop medical oncologists. Now you can't survive as an individual medical oncologist. The drugs are too expensive. We pay for the drugs, and so missing one dose or not getting reimbursed for one dose would bankrupt one individual or a mom and pop sort of type of operation. And so, we do have these much larger groups. I think our group, CSNF, is fantastic. We have over 30 partners, and I have been impressed with the people who work here, the physicians who work here. I think I'm getting another Nobel laureate every day, every time I meet somebody new. I'm surprised at the expertise that they have. And the way we are able as a team to negotiate all the different facets of medicine, not only keeping together and communicating as a group and knowing the business of medicine, knowing the research of medicine, knowing medicine of medicine, keeping up with our interpersonal relationships with other specialists. We work so well together as a team. And before, it was, mano a mano. That's what I see. That's what the biggest difference I see.
I think that, and Danny and I touched on it on an earlier episode. I think, at least for me personally, and I want to speak for you, Danny, what really attracted me to this group was that all the physicians that I met when I came here were very like-minded in that obviously very good at what they do, most importantly, of course, good clinicians, but good interpersonal skills, good people. And I think that may or may not always be the case depending on where you go. And it really just, the proof is in the pudding with how the testament to this group of being able to survive in an environment where outside forces may or may not be allowing you to do things you used to be able to do in such an easy manner.
Yeah. I think the power is in numbers. I think we had the fortunate ability to join a group which already had a solid presence here in Jacksonville and the surrounding area, and we're definitely fortunate to be with the group, and I think it's helped us succeed. Dr. Siegel, I think you guys have paved the way for us, and we're so excited to be here. And,
Grateful.
Grateful, definitely.
I recruited you.
You did.
Well, your dad recruited me.
Yeah.
On the golf course.
We have a phrase, and we say it over and over again. Cancer doesn't care. We do. That's just not a phrase. We are not a big hospital group. We are not an organization that is in it to see where they can make the next dollar. We are clinicians. We invest in our community. We invest in the care of our patients. And that is just not a slogan. That is the truth.
And just in my limited time since being here, I see it day to day. I think there's so many people that get turned away from, other options and end up talking to us in certain situations. And I know we do bend over backwards and make it work, because at the end of the day, it's about the patients.
Yeah.
If you're not providing good care, nothing else matters. And so I think that it's been an amazing experience being here so far to see that in real life.
I think the collaboration is bar none, because I remember even in fellowship, which isn't that far, back, we're talking
all those moons ago,
5 years ago. But to say that, we had tumor boards and we had discussions, and radiation oncologist, interventional team, talk about patient cases, but the collaboration we have with you, Rick, and the radiation team and our imaging and our outside providers too. I just think it's amazing. It's much different than what I had in fellowship. I think there was more of a divide between the radiation oncologist and the medical oncologist. Everyone kind of had their role, and I feel like we're talking about patients, whether we can collaborate or not. We're talking about patients together and finding what the right treatments are for them together.
So, our paths have crossed. You did your training in Emory. I did my training in Emory.
I did.
You did your training in Loyola in Chicago. I went to medical school in Loyola in Chicago. So there's
a part of you.
Yes.
And you were in Gainesville too for.
No, I wasn't in Gainesville.
Okay.
No.
You just like to think everyone's a gator.
Yeah, I just assume that people who are really good at what they do are obviously gators, and Dr. Siegel fits that bill. Come on, producer Brenna, let's go. I think we've touched on it on some other episodes, and I'd be interested to hear your perspective. You touched on it with your treatment a little bit, Dr. Siegel. Cancer care going from, what you would see in the movies, if you will, back in the day of, yes, patients would get a therapy and the therapy would cause more harmful effects than it would help with the cancer, to nowadays you're seeing people work full-time jobs. You were working in clinic and still getting treatment. Has it been, just from your point of view, just kind of describe that for me, seeing how it's all changed over the years?
It really is, it's night and day difference. I remember when I went to ASCO, which is the American Society of Clinical Oncology. It was in Dallas, Texas, and I think it was my first year here, first or second year here in Jacksonville. And we thought we had all the greatest anti-nausea medicines that we could have, just in one type of supportive care. And there's this new class of drugs that was coming out for anti-nausea. The company rented out this huge billboard on the interstate that was going to the convention center in Dallas. And I remember seeing its name, on that huge billboard. That class of drug had such an impact on the ability to treat patients and prevent nausea. And, we've expanded on that. We would have people who would have treatable cancers, but treatable and curable cancers, and would miss their treatments because of the toxicity of therapy. Or we used to have something we called anticipatory nausea, where patients all of a sudden got sick when they knew it was the day of their chemotherapy. Or they were driving to the clinic and they knew if they passed this one sign, it was the way to the oncologist's office. And so they got sick when they passed that sign, or there was some sort of smell, or as soon as they entered into the building, they would get, even before they got their treatments. And so for us ability to have the ability just to control that one side effect of cancer therapy, I think is tremendous.
From the radiation side, it's funny, when I was in training, some of the more senior attendings would say, you're never going to see, or hopefully never going to see, some of the side effects we used to cause in patients, undergoing different types of therapy. Because in my mind, I just remember thinking, you read about in the textbook what should be happening or what the rates are of certain side effects, but I wasn't seeing it in person very often. So that was my little experience with that, was just saying, oh, well, things clearly are gotten a lot better. So I think for patients and caregivers listening, it's exciting that if they're in the position where they need these therapies, we have so much more to offer them in terms of getting them through it in a good manner.
Another thing is that we used to give a lot of chemotherapy in the hospital. So if you were going to get chemotherapy, you had to be admitted into the hospital and stay in the hospital. And some of the treatments were multiple days of therapy. Now, almost everything is outpatient and outpatient therapy. So you can sleep in your own bed.
Or work in clinic.
Or work in clinic.
I've been trying to find Dr. Siegel's original headshot from
Oh.
the 90s, and I don't know where it is on my
I think
computer.
I think we should go for his college headshot and find that. I think that would be more entertaining.
I'll have to find it.
We do have pictures of my high school graduation
Oh,
picture.
You gotta send it.
They were in my office.
Oh, they are.
perfect.
And I think the best picture is when my brother graduated medical school. There's a picture of my family during his graduation, and I look like Epstein from Welcome Back, Kotter. I really did. I have that picture on my phone. I'll show you.
That's awesome.
Are you coming out? Your brother, is he a physician in town, or is he
So
working
I have
somewhere else?
So I have two brothers and a sister. My brother is a cardiologist. He, for years and years and years, for 35 years, he was in New Orleans, and now he's in Virginia. My sister is a PhD psychologist at West Point, and my brother is what we consider a Jewish boy who can't stand the sight of blood, and that's a lawyer.
Scott,
he
law,
lives in
law
New
or
Orleans.
medicine. Law or medicine. It's the only choice.
So he lives in New Orleans also.
That's great.
Oh, great.
And so this is not just a medical podcast, it's kind of a sports podcast a little bit. And
It is.
we touched on it a little bit before, but
Mm-hmm.
you're an avid golfer, and you have golfed in our tournament every year. Have you ever won the tournament? Because
Yeah, hold on, and let me just interrupt real quick. This is just so you know, this is Brenna's way of plugging the golf tournament, which we all respect.
what I have
but
to do.
yeah, no, she's paid for that. But yeah, have you won?
No, I have never won the golf
they
tournament.
haven't either, and
No.
they're
So
upset about it.
I personally have commented on some sandbagging that may be going
yes.
on.
Yes, there is.
We even tried to bring in more talent last year, and it
Right.
still didn't work.
We tried to cheat, and it still wasn't enough.
For the first time, we didn't have the tournament last year. Oh, we did,
We
but
did.
but I wasn't.
You weren't able to go.
Yeah, I think you were out of town, maybe. But yeah, we did.
There was some reason, yeah. So, but the year before is the first time I actually got a prize because I hit closest
Oh,
to the
yeah.
hole.
That's
Yeah.
right. That's right. No, it's a shameless plug for the golf tournament. No, benefits our Patient Assistance Foundation, which we use to patients undergoing treatment or even those who have completed treatment, helping them, making sure that their some of the day-to-day things that they need assistance with, we help them get through and allow them to spend more time with their families and not have to stress about some of the little things we, sometimes we take for granted when we're not in that position. So I think it's obviously a great thing. And anyone who's listening, who's interested, Brenna will maybe put a link to
Sure.
some sign up.
I
And
just redid the website.
yeah, exactly. So we can get more people involved, hopefully, with that. But not unless you're cheaters, then please, persona
Maybe
non
one of you
grata.
guys will win. Maybe someone else.
Oh, it's
they
not
will win.
about winning. It's about raising money for
Yes.
the foundation
Yeah.
and for enjoying the fresh air.
I don't know about these.
Yeah, what he said, I think.
You golfing this weekend?
I hope so.
So I think Marsh Landing, they're going to close down.
That's what my dad was telling me. That they're finally gonna
Really?
clean it up, right?
Yeah, I think Chet told me they're aiming at like October of 2022.
To reopen.
No,
Oh, to close.
to close.
Got it.
To close.
Because I know there was some talk of trying to get you guys, privileges elsewhere. Hopefully.
I'm sure they will, but for me, I roll out of bed and I go play golf.
Yeah.
If I
You're living the dream. If you have to drive somewhere, it may not be in the table.
living the dream.
He said he had an hour and a half of work left.
That's true. But rolling out of bed to play golf, in my mind, that's a dream.
I did dream about that as a kid, actually. So you're right.
The PGA Championships this weekend. So
It's going on right now. I was
Yeah,
listening
so-
to a little bit on the car.
these are the weekends where I really start to get real jealous of them.
Yeah.
My God, that'd
So
be-
you know who's leading the PGA?
No.
I didn't see who it was right now.
Phil Mickelson.
Is he? Wow.
Really? Wow.
He's 5 under. He's finished, and everybody else is still going on playing, and the wind is howling, and the scores are going up and up and
Oh,
up
yeah.
and up.
Kiwa
Yeah.
just gets harder throughout the day because the wind just picks up. Yeah,
Have you played there, Rick?
I have not. That's
Have you played it?
No, it's a place I think I'd like to play.
Yeah.
It looks fun.
all right. We got another road trip idea. Let's do it.
Looks like a score of 110 would be.
Why didn't we do this
probably-
podcast in Kiwa?
Yeah.
Sorry, I'll work on it. That and the TikTok will make it happen.
Exactly.
And the Monaco trip we talked
And the
about.
Monaco trip.
Monaco.
And
Ooh.
Asheville.
He's getting into F1 racing,
Yeah.
so we said
Oh.
There's
"We
a
gotta take
documentary series about it. Then now my wife and I we watched it and then we're into it now.
it." I like it.
I went with my wife and my kids, not this Christmas, but the Christmas before. We went to Lisbon and Madrid, and it was fantastic.
Wow.
Fantastic.
Heard great things.
You want to do my notes?
Yeah.
Oh yeah.
Well. Should we do that? Should we do the outro?
Yeah, let's do the outro.
Outro. All right, let's do it.
And then
Does that mean another joke?
I have one more.
Did you
Please,
request a
please
joke?
do not give this man any ideas about a joke.
Tell it, and I'll find another one for you for the next one.
Rick, there are people requesting jokes. Dr. Siegel
Listen, you
requesting my jokes.
you and your family
not resist it.
do not count as people who request.
My,
I know.
my family's requesting it.
My phone is blowing up, and it says, "We want more jokes."
We've had, how many CSNF employees have come in asking for the jokes today?
So many. My phone hasn't stopped
But
ringing.
you paid them to say that.
Well, no.
Coincidentally, it's all Beaches employees.
Yeah,
but
interesting. Yeah, funny how that works.
I think you should tell your other joke. I'll find
Okay.
another one for
I'll-
you for the next
Okay, let's tell another joke, Rick.
Sure, why not?
Let me flip my papers here.
Clearly, my
Actually, you're gonna like this
my
one. You're gonna
protesting
like
is
this
going
one.
nowhere, so I'll just learn to love
You'll
it.
come around.
I'll learn to live it.
And you might actually get this joke before I even say the punchline.
Are you saying I don't get most of your jokes?
Well,
That seems.
That's what he said.
I'm hurt over here.
you give
I'm
me
hurt.
funny faces every time I tell the jokes. I don't know. What's an astronaut's favorite part of a computer?
You got me.
The space bar. Come on, Rick.
Oh my goodness.
All right. So, thank you so much, guys, for joining us today on another episode of Medical Minute.
And as always, if you have any suggestions on things we should talk about, jokes we shouldn't tell, questions you'd like answered, or if you just want to say hi, you can email us at medicalminute@csnf.us.
And make sure you follow us on social media. Search Cancer Specialists of North Florida on Facebook and _CSNF on Twitter and Instagram, and soon to be TikTok.
That's what I've heard.
Yep.
I'm hoping. But as always, thank you so much for giving us a few minutes of your time. And double special thanks to Dr. Siegel for sharing his story. And hopefully it provides some wisdom and insight for those listening as to things to think about when you come into clinic.
Thank you, Dr. Siegel.
Oh, it was my pleasure.
And remember, when it comes to your health, stay informed.
Ask questions
And tune in next time.